the 30th of May at West Ham Memorial Park. It's 20 African countries. The current champions are Sierra Leone and Nigeria, well, of course, still a big house in football, not just in Africa, even in the UK. Well, Nigeria, of course, being champions once, and
they're taking it again.
You know, they're always in the last four, like just the Africa Cup. We've got Ghana that have won it before. We've got Uganda. It's 20 African countries that team up and meet every year here in the UK. The tournament has been going on now for 7 years. So if you're African, friends of Africa, please make a date.
Make a date, and that's what we're talking about, the unity we're talking about concerning the attacks in South Africa. This is like bringing all African countries together to form that unity we're talking about. So get involved in the UK Africa Cup of Nations. It's going to be good. It's going to be interesting.
It's going to be great. We've got a very good team of composed of the chairman, Mr. Marshall Go, and Daniel Antaya, the gentleman who does the marketing, and our founder, the founder of the UK Africa Cup, Dennis, was honored by Prince William as somebody playing a real cause in providing grassroots football. So if you're a footballer and you want to get involved, feel free to call us on this line and we'll put you in the right direction.
Yes, so like we said earlier on, we have a guest in the house. She's a doctor and she's going to be talking about diabetes today. In the studio today we have Dr. Hahara Shibiotimo. Welcome to the show.
Thank you very much, Tommy. My name is Dr. Hahara Babi Abarshi Shibiotimo. I'm one of the GP registrars from the East Midlands Deanery. I actually work in St. Peter's Hill General Practice in Grantham, which is in Lincolnshire. All right.
Okay, so now you're going to talk about diabetes. So what do we have to know about diabetes? What's diabetes? What leads to, just everything. I know you have everything, so keep it on.
Okay. Diabetes is a very big and large topic to talk about because diabetes has been causing loads of problems in healthcare right now, and it's one of those big things we really need to tackle. And a lot of things with diabetes need to do with what we can do, how we can control these, what are the lifestyle changes we need to make with regard to diabetes. But before we go into that, I'll just give you a brief summary about what diabetes is, and so you know the impact of the disease in the world right now. I'm going to give you a few facts and figures, which are a few statistics about it. So start with what is diabetes. Diabetes is actually a lifelong condition which can be really managed properly. But the thing is with diabetes, what actually happens is because we have high sugar levels in our blood, which is above normal. We do have sugar in the blood, but when it's above normal, that is what diabetes is. So back on the stat side of things, I got my figures from WHO website, and what it tells us that globally in 2012, when it was done, there are about 390 million people in the world suffering from diabetes right now. Yeah, so that's really a very big figure, and they have projected that in 2035 we're going to be having almost 600 million people suffering from diabetes worldwide, and so that's something we really need to pay attention on. But since we're in the UK right now, so I'll give you figures on the UK. In the UK in 2013 we had 3.2 million people with diabetes, and it's projected that in 2025 about 5 million people will have diabetes. So it's quite huge.
It is very huge.
Okay.
Well, I was just going to quickly say, Doctor, that, well, you said sugar levels obviously go up.
Yes.
So how can diabetes be managed?
Okay. Did you, basically, since it's because of sugar levels that we do have high amount, we have high amount of sugar in the blood. That's why we have diabetes. So management is basically based on, one of the first things we look at is people will tell them is about diet. Diet plays a big role in diabetes. It depends on what we eat.
So what's the best food you'd recommend for somebody watching, with diabetes?
Basically, I would recommend people eating healthy, especially if you are in the risk group, people who have a high risk of getting diabetes. You need to eat food which are low in sugars, carbohydrates. When I say sugars, I say carbohydrate, things that contain a lot of starch in it. And as Africans, we eat a lot of food with a lot of starch in it, so that has a lot of sugar levels. So we need to have little of that and eat more healthy, which is things like wheat, fiber, eat a lot of fruits and vegetables.
Yeah, and I was reading something earlier on the research, and they were saying something like there's a link to being obese and diabetes. Is that true?
Yes. Obesity is one of the biggest risk factors of diabetes. Obesity is something that public health is trying to tackle. People are all getting obese these days, and one of the biggest risk factors is that obesity. So usually what happens in obesity is the bigger people get, the more overweight people get, there is this insulin which is produced by the body to reduce the amount of sugar in the blood. What happens is when you're obese, that insulin usually is not produced at good amounts that we need. That's one. Another thing is sometimes the body gets insensitive to the insulin. So the insulin is there, but the body is not reacting to it. So that is what obesity does to make us have diabetes.
Yeah. So people with, because I know already people have diabetes already, and how can people who have diabetes, how can they manage this, we like call it illness?
Yes.
Yeah, how would they manage this illness?
Okay, for starters, one has to get tested to find out if they have diabetes. So testing for diabetes, we do it by blood tests. We will talk about symptoms later so that you know when you're going through these symptoms, you need to get tested. But usually it's from a blood test that is done. Usually you go and get the blood test done in one day, and sometimes blood results come out as borderline, so you might have to have it repeated to make sure that you do have it. If the results come back as positive, one of the first starters we do is, it depends on the level of the blood sugars we have. If it's extremely high, the first thing we do is lifestyle. Lifestyle is very important with diabetes. People need to stay active. People need to lose a lot of weight. So those are the things we're looking at. So we advise people, it's amazing when you see what happens about people who have lost weight, and when you check their blood sugars after that, they might go very back down almost to normal.
I was going to ask that, how often should one check their, their blood glucose level? How often should one check? We live in a busy, world where people work 24 hours or work half a day. They never have the time. But health is priority. How often should they check on their, sugar levels?
Okay. Basically, there's no really hard and fast rule on when you should check your blood sugar levels. But first of all, like the NHS, we do NHS health checks for people over 40 to about 75. So what happens is that when you get to 40, you're eligible to go and have these blood tests whereby they check different systems, and ruling out diabetes, one of the tests that is being done. So that's one, you can do that. And then if you are from an area whereby the risk factor of getting diabetes is high, or if you're overweight, or you feel you want to get checked, you can go and have it done. So it's basically, it's not something that you need to do regularly unless you're at risk or unless you start having symptoms, then you need to have it checked.
Yeah, I think we should go into the symptoms now. What are the symptoms of diabetes? Okay,
so basically the symptoms are some kind of general symptoms which might be not specific, which might also be for other diseases, but things like when people start urinating more frequently. So if you tend to go to the loo to pass water so many times, even during the night, people tend to go up several times. When you see people going 3-4 times in the night, that's one of the symptoms. Other things we look at is people who drink a lot of water. They're always thirsty, drinking and drinking and drinking and still not getting very satisfied. Things like people losing weight. People are eating normally, but then sometimes they tend to keep losing weight with that. In women, people can get recurrent infections. People can have things like vaginal thrush. People will have that, and you keep having it more and more commonly. That's one of the things you look at. And then things like having boils that don't heal. People tend to keep getting recurrent boils in different parts of their body. So you need to also get checked out. Other things that occur with men is people sometimes end up getting erectile dysfunction. So if you see we see people in clinic with erectile dysfunction, things we check, one of the first tests we do is to check if they're diabetic. And people getting wounds.
So can that lead to what you just said, somebody having erectile dysfunction if they've got diabetes? Would that be a factor that has led to the dysfunction?
Yes, sometimes diabetes is one of the causes of erectile dysfunction, because sometimes what happens is in diabetes, blood sugar levels are very high. When these blood sugars levels get very high, what happens is these make the vessels, the blood vessels all over the body, it makes it very, very thick and hard. So when it causes a lot of thickness and narrowing in these blood vessels, it doesn't supply the areas where blood needs to flow properly. So that's why it affects the function.
So you as the NHS, I mean, you're one of the best, in the world. So when you find out, or that person is diagnosed with diabetes and they're dysfunctional, are you able to treat them and become functional?
Yes, we are.
And how do you do that?
Basically, what we do is, as I said, lifestyle, which is one. We always put lifestyle first, and then the next thing we go into is medication. If lifestyle is not working, we move to medication. Medication, we have various medications. We have...
So I was going to just say that Tam not with us, but then, me and Tammy always do this race. Yeah, we like running. She's faster than me at night, but in the morning when we race, I'm faster.
Okay.
Yeah, me and Tammy do a race. It's called the band breakfast race once a month. Yeah, so exercise. You know, we love to exercise with Tammy. Can exercise actually help somebody with diabetes?
It would help.
In what way? Explain to us. Tell us.
Okay, basically, as I mentioned earlier, the weight issue, what happens is that the body becomes less sensitive to the insulin that reduces the amount of sugar in the blood. So what exercise does, it makes people, the body become more sensitive to it. So that's one of the ways that it does happen.
Yeah, and another thing I was reading again, they were saying that if you not really skip your dinner, like if there's a long break between your dinner and your breakfast, especially in women, it can help in not making you having diabetes. Like have a little bit of dinner and wait till the next morning. Is that true? It was just something I read. I just want to know.
I'm not sure how factual that is. Basically, what we're looking at is having generally low levels of sugar levels, which is not low levels, normal levels of sugar levels in your blood. What we prefer is having normal levels throughout the day instead of having areas whereby you have very high levels and then you come in to have very low levels. But it could be, but I'm not sure about that.
Yeah, and before we go on, let's tell our viewers that we have a doctor, Dr. Hahara Shebiotimo. She's talking on diabetes, symptoms, how you can manage it, and how not to have diabetes. The number to call is 0208-808-0693. If you have any questions for her, like I said, you have a free GP session today. You know how you do when you call and they're like, is it an emergency? Okay, no, we can't see you today. You have a free GP in the house. Any questions you want to ask her in terms of diabetes, how to have it, I don't know the questions you have, but the lines are open for you to call and ask her a few questions because time is not on our side, so you need to do it really quick and fast. So continuing on...
No, go on, continue.
Okay, yeah, let's Dr. Hahara continue on the issue of diabetes because I know she's got loads on her.
Yes, I've got loads, but probably where I stopped, we've answered a bit of the questions on it, so it might be a bit of repetition, but I can go ahead and just fill it in. I hadn't talked about types of diabetes. We have, in fact, we have three. Three, but we're not going to talk about much on two of them. The first one, we have the type 1 diabetes, which is usually common in younger people, and usually that is usually caused by, it's called an autoimmune condition whereby the body fights against the body. So it's kind of different from type 2 diabetes in the sense that what happens is that insulin I was talking about, the cells of the body has destroyed the gland that produces that, so you don't even have the insulin. That's why type 1 diabetes are treated straight with injections, which is insulin. So that we can't really play a big role in it. So, but the main one, which is the biggest one, is the type 2 diabetes, which is 90% of the diabetes people suffer from, and that's the one we can control and we can and manage much better with regards to future complications of the disease.
Okay, and this diabetes thing, is it genetic?
Yes, there's genetics plays a big role. Diabetes has a multifactorial causes, so different things can cause as a combination of different things. So genetics is another big one. It plays a big role. South Asians are usually higher risk, Africans are at big risk, and Afro-Caribbeans are at big risk of getting it. So that's where we come into genetics also plays a role in it.
How about when maybe like now you have maybe a parent or a sibling that suffered diabetes? Is that tendencies for...
Yes, the tendency is much higher. You're 2 to 6 times much higher risk of getting diabetes if you do have a first-degree relative with diabetes.
Diabetes, okay.
Interesting.
So,
can it be cured? Can diabetes be cured one day?
Not really.
If we put 55 million doctors like you in a lab, I'm sure.
Hopefully, I wouldn't mind being the one to find out the cure. but
is something being done?
Yes, lots of research is going on various things and ways to see if we can bring out other things. But since the disease is mainly caused by lifestyle, so I think there's no such thing as a magic pill that will sort everything out. We need to also take responsibility and do something.
So you said it's genetic, so obviously it's in us Africans.
Yes.
I'm sure you've been to Africa?
Yes, I'm from Nigeria.
You're from Nigeria. When last were you in Nigeria?
Last year.
Last year. Obviously, you do look at the health sector in Africa. What do you think are the problems that we're having in that area, diabetes? Because I know so many friends in my country who are diabetic. How can it be, improved in Africa? I know we've got so many diseases that need to be improved, but diabetic, how did you look at diabetic in Nigeria?
I think what people need back home is awareness, because people don't even know that they do have it. And with diabetes, the problem with it is that when people start having symptoms, that's when you're already having complications. So people tend to start even having the complications 5 to 6 years before they start getting that disease. So it's quite difficult because they get diagnosed at a very late stage when loads of things have gone wrong, and it's quite difficult, and people don't even understand the impact of the disease, so they don't know how well to control their blood sugars. And it's not like when you're having a heart attack, you have chest pain and you know that, oh, I need to do something about it. You wouldn't even know if anything is going on unless it's getting too late. So that's the problem.
It's dicey. It's really dicey because somebody might be diabetic and you wouldn't even know. So I think what should be done should be regular checks. Just regular checks.
Do people die inside sometimes? Because we've got stigmas as especially our continent. Do people sometimes die inside? They don't want to express themselves or take medication. Is it one of those, or people get on with it?
I don't. It depends on your health belief. I don't think diabetes is one stigmatized disease, but then I would say condition, but. I would say it depends on the health beliefs you have and depends on where you're from, because it depends on the circle you're on, because diabetes is something that loads of people have. And
actually, we didn't also talk about what can make it worse if you're diabetic. What are some of the things that you think can make it, worse? I know if you've got something like a pancreas problem, alcohol is not the best.
Yes, alcohol
answer.
is definitely, yes.
So what about with diabetic? What are things one has to avoid doing?
Generally, it's basic lifestyle interventions. We tell people alcohol can make things worse. Alcohol has a lot of empty calories, lots of sugar in it. That's something we tell people to cut down, or even it depends on what they want to even stop. Other things we look at is smoking. Smoking is usually dangerous to health in every way, and it fuels loads of other things. So smoking is something people should avoid. Another thing people tend to, especially when I speak about people back home, tend to, when they worried about diabetes, all they stick to is, oh yes, I need to buy this diabetic rice, or I need to buy this diabetic food. Usually, we don't tend to promote people going on diabetic foods. All you need is small amount of the food, because you're going and spending a lot of money on all these marketing products, but the difference is not really that much. So you can eat normal diets, but small quantities of things which contain sugar.
That was so good. Very intense information about diabetes. We don't have enough time as usual. So in case if you don't call now, unfortunately we won't be able to take your calls anymore. But I know Dr. Hajara has explained everything in depth about diabetes. So
is there any website actually?
Is there anywhere we can?
Basically, if you go to patient.uk website, it's a very good website which will give you information on diabetes. It can give you information about symptoms and signs. Website on lifestyle measures you can help. Everything, it will be on patient.uk website. I tell my patients all the time, it explains everything in detail, and it wouldn't give you the scary information that people will find on Google. So
that's good. Dr. Ajara, we really appreciate your presence. Oh, we have a caller now. Now we have a caller. We're just going to take this call, and that's it. Hello, good morning. Hello. Hello, good morning.
Hello.
Good morning. Welcome to the show. What's your name and where are you calling from?
Yeah, good morning.
Do you want to turn down the volume of your TV set? I can see it's echoing, please.
Okay.
Thank you very much.
Can you hear me now?
Yes, I can hear you nice and clear. You want to talk to the doctor?
Yeah, I just want to ask a question. Like, she mentioned that if you are eating a starchy food, it can cause diabetes or something like that. How about taking ordinary sugar, too much sugar? Can they cause diabetes? And does he have age, because like my daughter, she always likes to take 2-3 spoons of sugar in a tea. Is it healthy or it's not healthy for her to take that, something like that?
Okay. Basically, everything you do, you need to do it in moderation. So we advise everything done in moderation. And if you're actually at risk of getting diabetes, the best thing is to cut down the amount of things that you take, which has a lot of sugar in it, because of course it's the body trying to bring down the levels of sugar you have in your blood. So the more sugar you take, the more the body struggles to bring it down. So if it's less, the body wouldn't do much work, and then that is not actually pushing you more towards diabetes.
Does that answer your question?
Yeah, you have answered the question anyway. So what you are saying is that, like the starchy food, we should reduce it, or we shouldn't even eat it at all?
Mainly reduce it. Nobody is saying don't eat anything starchy, but reduce it, because if you check with starchy food, the calories in it is quite a lot, and you know with high calories it leads to obesity, and the obesity again makes diabetes worse or makes people get into diabetes. So it's a vicious circle. So it's better to reduce it. So go ahead, eat your food which is starchy, but not a lot of amount and not all the time. So just bring it down the quantities, because quantities are relative. Somebody will tell you that they're eating very little, and when you see, you're shocked. So it's very relative.
Yeah. So that answers your question?
Yeah, thank you very much.
Thank you so much for calling. Thank you so much.
Thank you, bye.
Thank you. We won't be able to take more calls because time is not on our side, and we have another guest in the studio. So I want to thank Dr. Ajara for coming. We really appreciate it. I've learned a lot. I'm sure Chinade has learned so much.
I feel like a doctor. I feel I'm going to lecture somebody today in diabetic, and I'm sure the viewers at home. I think it's very important. So we thank you, again, and we'll stay with caution and send the information out.
Yes. Okay. So we'll go on a short break now. When we come